Every 2 seconds, someone in the world needs blood. Next Monday marks World Blood Donor Day, and it comes as there is a tremendous supply issue with the need for donations. Joining us this morning to talk about the blood shortage and how you can help is Dr. Chris Lege with Touro Hospital. Dr. Lege, good morning. How serious is this need?
Well, John, it's become a bit more serious as we are seeing it at most of our local facilities. So while this is a nationwide shortage, it is affecting us locally with our supplies of blood products being significantly less than normal due to reductions in donations.
Okay, so we'll do these interviews from time to time. It's the holiday season. People are distracted. They don't donate blood. In this case, I get the sense that this is a bit more chronic than just your normal.
It is. It's actually been the shortage has been going on for a few months now, and it is very related to COVID and people's reluctance to donate, combined with, as we have been coming out of COVID, a lot of elective surgeries that were postponed are being performed now. So we're seeing a much bigger need for blood for those types of things, even though our chronic need in urgent settings hasn't changed. The combination of less donations and increased supply needs due to surgeries has led to the current shortage.
So, I mean, what are the consequences if this were to continue?
Well, I think that, there are situations where people urgently need blood, and we will always take blood from elective areas to meet those needs. That includes, women delivering babies who are hemorrhaging, traumas, cancer patients. But the concern is that these elective procedures, things that were put off, that we know going in will need blood, may need to be postponed because the supply is not there to meet that demand.
I get why a year ago people would have been reluctant to give blood, or in some cases it almost would have been impossible for some people, given the situation they were in. But today, what would you tell people about the safety of giving a blood donation?
Yeah, so we've been dealing with this pandemic for a long time now. So our blood centers and the places that are doing and accepting donations have adopted and are following all the CDC guidelines. So it is very safe to give blood. They're following distancing parameters. They're allowing appointments, so that minimizes wait times, and following all cleaning procedures necessary. And so it is exceedingly safe to go and give blood. It's always been something that, not a large percentage of the population donates. It's a relatively small percentage. We're hoping by getting the word out, we can increase that percentage of people willing to donate.
Right. And sometimes when people, start it almost becomes like a habit. Like, okay,
correct,
months have passed, and let me go do that little civic thing again.
You can donate safely every 2 to 3 months if you're eligible. The statistics are about 40% of the population is eligible to donate. Less than 5% ever get around to doing it.
All right. Well, an important message. We appreciate you bringing it to us, Dr. Chris Lege from Touro. Thanks so much for the message this morning.
Thanks for having me.
All right. The time now is 8:17. Let's get an update on